Welcome, everyone. Today, we're talking with two experts, a financial planner and a Medicare broker, to shed some light on our topic of health savings accounts, or HSA, and their role in managing your healthcare costs during retirement. So let's dive right in. Our first guest is Steve. Introduce yourself.
Thanks, Bob. I'm Steve Gibbs with Mahal Advisory Services, and I've been doing this since 1995, showing people how to create their financial future and live it out in comfort. I'm excited to discuss how HSAs play a critical role in healthcare planning for retirement.
Sweet. Next to him is Helena. Will you introduce yourself and what you do?
Hi, I'm Helena Fouts. I'm a life and health insurance broker specializing in Medicare. I will explain how HSAs can complement Medicare coverage and contribute to a secure retirement.
Wonderful. So we're going to jump right in with Steve. Briefly explain what a health savings account, or HSA, is and how it differs from other healthcare accounts.
Sure, Bob. So a health savings account, or HSA, is a tax-deferred savings account specifically for healthcare expenses. So the money you contribute is tax deductible, and the money you take out, if it's used for a qualified medical expense, it comes out tax-free. So that really makes it a strategic part of an overall retirement plan. So the funds are great. They roll over from year to year if you don't use them. I mean, there's some specifics and specific things you need to know about how to use them, but yeah, that's generally how they work.
Tax deferred and tax free, my favorite stuff.
Some of my favorite words, yes.
So can you have, sorry to interrupt, Bob,
yeah.
can you have an HSA alongside your regular health insurance plan?
Well, that's one of the drawbacks is in order to you can always have the HSA account, but in order to contribute to the account, in the year you make the contribution, you also have to have or be participating in what's called a high-deductible health plan.
Oh, no.
And those can be problematic, especially if you are not super healthy.
Yeah, no.
So,
Okay. All right, Helena, your turn. How does having an HSA complement Medicare coverage, especially for someone planning for retirement?
It's another kind of savings. Once you enroll in Medicare, it's literally illegal to contribute any more money to an HSA. So if you have one, plan to contribute as much as possible before your HSA becomes illegal. So stuff that account.
right.
Yeah, so you can take advantage of any tax benefits. You can use the money in your HSA for any Medicare expenses, though, like your premiums, deductibles, co-payments, cost of medications. The only thing I would tell you is keep your receipts.
Excellent point.
Awesome.
Steve,
Yeah.
as a financial planner, how do you guide your clients to maximize the benefits of an HSA in their retirement plan?
Well, Bob, that's a great question. I mean, one would make sure that that's something that makes sense for them at the time, early on, and even later if they can. As with any other kind of a savings plan, we want to make sure that they start contributing as early as possible and as often as possible and as most consistently as possible. So this builds a robust financial cushion, for healthcare expenses in retirement. I also advise them to strategically use their HSA funds, considering the tax advantages. It's a holistic approach that aligns with their overall retirement goals.
So, add early, add often, kind of like the way I vote, early and often. Valuable advice,
Yeah.
but so okay, Helena, those who may be considering opening an HSA, what key factors do they need to keep in mind?
Well, do this as early as possible, like Steve says, because once you're getting close to Medicare age, you're not going to be putting much into it.
Right.
Because there is one thing, if you keep working after you're age 65 and you're staying on your employer coverage or something, pay attention, because when you actually do enroll in Medicare, there's a 6-month look back. So you should stop contributing to that HSA 6 months before you apply for your effective date of Medicare. So it doesn't matter if you're saying, oh, my Medicare starts October 1st, but if you apply during July 1st, that's the month they're going to look at.
There's always a gotcha somewhere.
Yeah,
Yeah.
because you
Oh
don't
my
want
gosh.
to have any
Yeah.
tax problems, because that's what will happen if you contribute then. Another thing to do is get familiar with what the qualified expenses are. What can you legally spend on with this kind of thing?
Wow.
Long-term care, for example, like you said, you
Right.
may have said earlier. And then
Yeah.
remember to keep your receipts.
Always keep your receipts.
Keep good records.
Yes.
That's
Yeah.
that's important for taxes as well too. So good advice, Lena.
Yes.
Yeah.
All right. Thank you both for your expertise on the health savings accounts, HSAs, and their role in financial planning. It's been enlightening for sure. If our audience has any questions, feel free to reach out and ask questions. Till then, we'll see you next, and stay financially savvy.
Take care.